Fat grafting and facelift surgery. Welcome back to Rohrich Knows podcast. We talked a lot about facelift surgery. What makes a facelift look great? Well, I think the most important thing is analysis and deep layer facelift surgery, but fat grafting is the secret ingredient. So let's dive deep into what it is that makes the deep layer facelift and fat grafting so harmonious and synergistic together. You know, we've talked a lot about the deep layer facelift, the deep plane facelift, but we don't always talk about where we put the fat selectively, and that's in the central part of the face, because that's the area that you can't lift no matter how deep your facelift is. So that's the cornerstone of correction of deep facial aging, and that's where you put it. You put it into the deep part of the face, the area that actually is deep to the mimetic muscles, the deep plane, and you put it in precisely on there based upon the preoperative analysis. And then you shape the face in the outer area. It's like doing sculpture. You're doing the sculpturing first, and then you're lifting it. And that's truly what you're doing. And that's really differential fat grafting. The fat that's deep is bigger, and the fat that's superficial is smaller. So you always want to replace like with like. So let's go through this journey. You're taking macro fat from the patient's face, you're taking it from the inner thighs, and you're putting it into the deep layers of the face. So you're separating out the macro fat, and you're also separating out the micro fat. And then the micro fat is then homogenized in a small strainer to make it much smaller and make it so you can put it into the superficial part of the fat of the face. And really, the small particle fat stays superficial, like around the eyelids, like you're showing in this patient. And then the deep layer is actually going into the deep part of the face, the deep malar components. So you're replacing what's lost like with like. So those are the deep fat compartments, and then you're putting it into the safe. In the superficial compartments, you're putting a different type of fat. This is the fracto or the micro fat in that area, and that's very, very powerful. So then you're also, after you're doing the shaping, what you're doing then is when you're done looking at the face and you've done everything, and then you're going to do some selective final finesse fat grafting. You're doing it in the malar area, you're doing it in the deep malar compartment, and you're even doing it on the jawline area. And you can see how you do that in the jawline. You can shape it. You can see that when before you redrape your skin, you're taking a look and you're seeing your jawline, your shaping of your jaw, and then you're putting some into the mandibular border in that area. And that really outlines the beauty and shape of this. And you're doing that 1 or 2 cc's in this area, very carefully contouring it. And it gives you the shape and contour that you want. And so remember, deep to superficial. That's how the power of filling and then lifting with the smash. So here's where you're placing the deep in the red and the superficial in the upper portion of the malar area. You can see the beauty of how that's shaped her face. And here's the anatomy of that, where you're looking at the deep facial fat compartments. It's very, very powerful. So superficial and deep fat compartments, reshaping, smash. Another patient, same thing. Deep and superficial fat shaping, contouring. Another patient, 3 years post-op. You can see here the differential fat grafting, superficial and deep, and then here she is at 3 years post-op, just to have reshaped her entire face, eyelids, neck area. Very powerful technique that has incredible longevity and natural look. That's really what you want to do. You want to allow you to have a patient that has early signs of aging. You want to then do the deep facial fat and the superficial facial fat, and then a deep layer facelift, and give you the shape and contour that you desire, that makes the patient look good, look natural, and look long-lasting. But that's the trio of really of what you need to do to get optimal results: filling and lifting. Another patient, same type of example of filling centrally, the superficial fat and the deep fat, completely different types of fat, and then you're doing a deep layer facelift. So in the male, same thing, except you'll need a lot more fat, especially into the malar area, because in the malar differences are that you want to highlight the arches in the female, but in the male you want to just keep their malar eminences shaped and contoured, and so that's what you want to do. And then you want to actually do a mastectomy or a deep layer facelift. And here's an example of a patient that had that, shaping deep with superficial and deep fat placement, and then a mastectomy, jawline reshaping of the mandibular area, correction of the jowls, and also shaping of the neck. And of course, another patient, same thing, central filling, outer layer lifting and filling, really giving you a natural look to the face. Same procedure with neck contouring and shaping. All of this is done the same way, and I think the goal here is to do differential fat grafting based upon preoperative analysis to really give you a long-lasting yet natural look to their face. And I can't overemphasize that, how powerful this technique is. And really, fat grafting is the key element in facelifting, along with the deeper layer facelifting, because it gives you a natural look and allows you to customize the facial rejuvenation in a very anatomic way, replacing like with like. So, deep plane lifting in the outer face, filling in the inner face, natural long-term results. That's the key in facial rejuvenation. So give me your comments, give me your thoughts. Until next time, stay safe, stay well informed, and tune in to other podcasts on Rohrich Knows.